In this video, I'll discuss the pathological features of smooth muscle tumors. So let's start with leiomyoma. Leiomyoma is a combination of three words. Leo means smooth, myo means muscle, and oma means benign tumor. So leiomyomas can be defined as benign tumors of smooth muscle cells. It mostly arises in myometrium of the uterus, and we know that uterus is lined by three layers: endometrium, myometrium, and perimetrium, and it is a myometrium that contains smooth muscle. So these smooth muscle cells undergo neoplasia and become a benign tumor, which is leiomyoma. Secondly, these leiomyomas are also known as fibroids because of their firm nature. And the other sites of occurrence are erector pili muscles, where it is known as pilar leiomyomas, and it rarely occurs in small intestine, colon, and the urinary bladder. Note that leiomyomas often occur as multiple lesions. Then these fibroids are the most common benign tumors in the females, where they are affecting 1/3 to half population of women in reproductive age. So you can imagine how common they are if they are affecting 30 to 50% of the population. So let's discuss the pathogenesis of leiomyomas. Leiomyomas are caused by interactions between genetics and hormones. As far as genetics is concerned, the common disturbances are rearrangements in chromosomes 6 and 12. Mutations in MED12, which is a gene that encodes a component of RNA polymerase transcription complex. And third, the loss of function mutation in FH gene. And fumarate hydratase is an enzyme of the Krebs cycle, and this association constitutes an example of link between the metabolic abnormalities and neoplasia. Second component of pathogenesis is hormones. So in hormones, estrogen is the hormone that favors the development of leiomyomas. So you know that I discussed previously that fibroids occur in the reproductive age, and why they occur in the reproductive age. Now we have got the reason that these leiomyomas are estrogen responsive. So you know that in reproductive age the quantity of estrogen is maximum. So relating to this, leiomyomas usually develop in the reproductive age. After the reproductive age, the estrogen level falls, so the risk of developing fibroids also decreases. In fact, most of the fibroids regress spontaneously after the menopause. Second thing that can cause fibroids is oral contraceptive pills, especially if they contain estrogen and not progesterone. Now the morphology of leiomyomas. As far as gross features are concerned, they are well circumscribed gray-white masses. Now why they are well circumscribed? Obviously they are benign tumors, so they have a clear well-defined boundary, and they have whorled curled surface. I discussed the whorls in microscopic features. And there are three main types of fibroids: intramural, subserosal, and submucosal. I'll discuss them one by one in the cross section of uterus. So here you can see that this is endometrial cavity and this is cervical canal. So here in between the muscles of the uterus, this is well circumscribed growth, which is called the intramural fibroid, as it is between the muscles of the uterus. The second variety is of subserosal type. Now what subserosal means? Here you can see that it is present on the surface of the uterus but beneath the serosa. So it is called subserosal, means beneath the serosa. Then the third type is of submucosal fibroid. This is endometrial cavity, and this type is known as submucosal fibroid because it is present beneath the mucosa, or we can say that it is present beneath the endometrial lining. This is endometrial lining. Here you can see this is endometrial lining and it is present beneath the endometrial lining or beneath the mucosa. So it is the submucosal type of fibroid. And sometimes they extend through stalk and can develop as parasitic leiomyomas that can drive their blood supply from the adjacent areas. As far as microscopic features are concerned, they are very simple to remember. They are the whorls of smooth muscle cells, and there can be fibrosis and calcifications. So inside here you can see that there is eosinophilic fibrosis, and there are the whorls of smooth muscle cells around. The important thing in this leiomyoma is the intersecting fascicles, means that one muscle fascicle is in this fashion and the other is in this fashion. So the intersecting fascicles are 90 degrees to each other. And here you can see that there are spindle-shaped cells having oval to elongated nuclei and eosinophilic cytoplasm. And again, the muscle bundles are forming intersecting fascicles. These are in the longitudinal fashion and these are in the horizontal. So the plane of muscle fascicles is 90 degrees to each other. There is no necrosis, no atypia, and no mitotic activity in leiomyoma. Now in clinical features of leiomyomas, most of the fibroids are asymptomatic and they are diagnosed accidentally, and sometimes they can present as palpable pelvic masses. In some cases they can cause abdominal pain because they can be large and can cause pain. So they can cause menorrhagia as they are growing inside the uterus, so they can undergo bleeding resulting in menorrhagia, which is heavy menstrual bleeding. And they can cause mass effects. Mass effects means that they can cause symptoms that are caused by the compression of the adjacent areas. For example, if the fibroid is growing large and it is compressing the ureter, so it can cause disturbance there. Infertility can be the complication of leiomyomas. And why this infertility happens? Because we know that fetus grows inside the uterus and the leiomyomas are developing in the wall of the uterus, thus interrupting with the growth of the fetus. Now let's discuss leiomyosarcomas. Leiomyos again means smooth muscle cells and sarcoma means malignant tumors. So they can be defined as malignant tumors of smooth muscle cells. They are most commonly arising from the myometrium of the uterus and they develop from mesenchymal cells in the myometrium. So the mesenchymal cells present in myometrium differentiate themselves into some abnormal cells which are called leiomyosarcomas. And they are usually less differentiated as compared to their benign counterpart, which is leiomyomas. Another important point to remember is that they usually affect the post-menopausal woman. And while discussing leiomyomas, we saw that leiomyomas develop in the woman of reproductive age because that was estrogen dependent. And the other sites of occurrence of leiomyosarcomas are deep soft tissues of extremities, retroperitoneum, and they can also arise from the great vessels, and they mostly occur solitary. Now let's see the morphology. In gross features, the leiomyosarcomas appear as soft, hemorrhagic and necrotic masses. Remember that the fibroids were well circumscribed, but these leiomyosarcomas, they show the areas of hemorrhage and necrosis. For microscopic features, the keywords to remember are the leiomyosarcoma. So the word is self-explanatory. Leiomyo means the tumor cells resembling the smooth muscle cells, but sometimes undifferentiated tumors appear as anaplastic cells. They do not resemble the smooth muscle cells. So remember that the tumor cells can be smooth muscle-like or they can be undifferentiated. And now we know that sarcoma means malignant, so we'll see the three features that differentiate the leiomyosarcomas from the fibroids. The first is cytological atypia, which means development of atypical cells. Then the mitotic activity. So the leiomyosarcomas, they are aggressive and they are more growing tumors. So they show more mitotic activity. And as they are more growing tumors, so they are dying fast too. So we'll see the areas of tumor necrosis.